Coming up on American Medicine Today, the NCAA is hit with a lawsuit claiming they failed to protect their players from concussions. Legal expert Andrew Reed joins us to discuss the most recent developments. Next, Steve suffered from a herniated disc that made it nearly impossible to stand. After discovering the Bonati Spine Institute, he made the trip to Florida and is now happily living pain-free. Finally, a New York surgeon is challenging the No Surprises Act federal bill passed in 2020. Dr. Bonati invites Dr. Daniel Haller to the show to discuss this case. Will the suit stop insurance companies from taking advantage of healthcare? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So the issue of concussions in sports, and football in particular, has been front and center in recent years, and a lawsuit against the NCAA for failing to protect its players nearing trial in Los Angeles in what could become a landmark case. Now, joining us to discuss is Andrew Reed, legal expert and associate at Karstens, Allen and Gorley in Dallas. Thank you for joining us.
Thank you. Glad to be on.
Tell us more about this wrongful death lawsuit against the NCAA. And it was filed by the widow of Matthew Gee, a linebacker who played with USC. Is that correct?
That is correct. So this is a case where they are trying to say that his concussions back when he was playing on the 1990 Rose Bowl team, winning team, was ultimately what led to his death. Most likely what I would see here is that you're going to see a lot of disputes over the medical results. One thing is they're going to look at how much was it a cause and contributing factor to his death. Was there other factors that could have resulted in his death? So there'll be some interesting situations to see here.
How did he die? Because I didn't see that in any of the materials that I was reading, any of the stories. How did this particular player die? Because he was actually teammates with Junior Seau on that USC Rose Bowl team. And if anybody didn't know, Junior Seau actually shot himself in the chest and killed himself. After the fact, they found out that he had massive CTE brain injuries. So how did this particular player that led to the lawsuit, how did he pass?
My understanding, what I have been able to find is that it appeared to be somewhere along the lines of similar to natural causes. There wasn't a suicide or anything of that nature. I have seen one report that said that there may have been some contributing factors, possibly from some drug and alcohol. We don't know exactly what everything is going to come out until it's presented at trial and see what the evidence shows. So right now we're still a little bit in the dark as to what everything is, because not everything has been made public. So we're kind of wait and see until it starts coming out.
When they say natural causes, though, and then you have like traumatic brain injury or concussion, I mean, that doesn't seem too natural.
It's one, I'm not a medical expert, so I'm not going to delve into that. But it's one, personally, I believe where it's going to ultimately come down to is what can his widow and his family show that was the cause of his death.
Sure.
And that anything else that may have been a factor is not really a cause in of itself.
This lawsuit is not fair for the community. It's not fair for the university. It's not fair for anybody, including the person who got injured. You have a lawsuit for everything in this country.
Well, I don't think you're right there, Doc, because here's the thing. They hire these individuals. They know already that those heavy impacts cause traumatic brain injury and concussions. And that's what these individuals, they're paying them a high dollar amount, but what does it matter if they're dying from these type of injuries? They're using them.
And why the law is not protecting you, saying you are not going to play this game,
right?
Because this game is going to cost to society a lot of money, and it's going to create somebody who's young who's going to be dying.
Well, that's because they're lying to the players, telling them that nothing can be wrong. And I think that's why they're bringing up lawsuits like this. They're being led to believe it's just contact sports. It's all fun and games.
Kimberly, I disagree totally. If I tell you that a guy with the strength and the amount of muscle developed is going to charge against my head, I promise you I will run like crazy in the wrong direction.
A lot of
so
money
let me
for
tell you this. This is not correct.
Okay.
They are allowing this to happen for an economical reward. The players know there's a tremendous economical reward, and the university does, and everybody else does. But you know something? When something happened, everybody's guilty.
So what do you feel about this, Andrew? Why don't you give us your legal expertise here? Because
Are you still here, Andrew?
It seems like a no-winning battle between Doc and I on this subject.
So ultimately here, this case will have some severe ramifications, I think, if it actually goes to trial and the NCAA loses, because you are going to see all of these schools, all these organizations that oversee sports, in particular football, that they're going to have to account for these things and other injuries that can have long-term effects on players. Now, I will say that there is high likelihood that this case settles before it actually goes to trial. Most cases ultimately do. A lot of times it is right on the eve of trial or even during trial. There was a previous case against the NCAA with some similar facts, and it actually settled during the middle of the trial. So this will be interesting to see how it turns out. But yes, it will. If it does, in fact, go to a jury and the NCAA loses, it probably will have ramifications for all sports organizations.
If it does settle, I have to ask, isn't that to kind of squash responsibility so that still no one will really look at these sports organizations and hold them accountable? Isn't that why they settle?
That settlement is always one as part of settlement, typically you will not anywhere admit any type of guilt, and there will usually both parties will say this is confidential, so no information is shared. Now, it's one here, will more people still go and sue the NCAA for wrongful death over concussions? Potentially. It's just going to be a kind of a wait and see situation. So, but I think also recently I do note that there was the CDC updating its head trauma injury standards and all of its procedures for that. So I think you're going to see some of this coming about and changing now as time goes on.
Thank you so much for keeping us updated. Andrew Reed, legal expert and associate at Karstens, Allen and Gorley in Texas, about this ongoing lawsuit against the NCAA for concussions. Thank you for being on the program.
Thank you for having me.
Coming up after the break, a story of recovery.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 70,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
My name's Steve Zimmerman, and I live in Ontario in a little town called Midland on the edge of Georgian Bay. And I am a retired pastor, and I now author books and sculpt in stone.
In 2017, pain developed in Steve's lower body, forcing him to stop the work he loves so much.
When one is sculpting, obviously you're standing for great lengths of time, and I noticed I was becoming very sore after a couple of hours, and that pain progressed quite rapidly until about November, when I went for an MRI and discovered I had a herniated disc. I went to Los Angeles to have it dealt with, and it was not successful. And I started to question whether or not that was the root of my pain. The pain began with a very uncomfortable feeling in my hip, and it began to radiate down my left leg, and a numbness ensued that ended up right down the sort of front and side of my leg. and the pain became excruciating. I couldn't stand for more than a couple of minutes just having a casual conversation with someone. And lying down, oddly enough, caused me an awful lot of pain. I could lessen the pain by sitting for short periods of time, but it really started to impact my life. I couldn't sit and write for any length of time, certainly couldn't sculpt, so it just became debilitating.
He and his wife took off to the Sunshine State, and for Steve, down the road to recovery.
So when I came to Florida, I almost immediately began to search for facilities that I could go to get some help. And in doing so, the Bonati Institute came to mind. I made a phone call and I was asked to, after a short discussion of what my problem was, I was asked to get a MRI, which I did, and I was promised that a surgeon would call me within 48 hours. Being from Canada, where wait times are measured in years, I was astounded that I could get that kind of response. So I had an MRI, and 2 days later I received a call from a surgeon who discussed what my condition was and why I was in such agony. After reviewing the MRI, the surgeon indicated to me that I had osteoarthritis in my back, up and down my spine. But in this area, it was worse, and I had developed severe stenosis, which was pinching the nerve going down my leg. So the next step was to schedule me coming in for the preliminary, I suppose, of having surgery. And when he asked me if 2 days hence was convenient after I got off the floor, I said absolutely. So I was just amazed at the response time and just the calmness and the whole attitude of, we know what your problem is and we're here to fix it.
With his initial experience on the phone with Bonati being unlike anything he's ever experienced in Canada, Steve confidently decided to move forward with his treatment and visit the Bonati Spine Institute for a consultation.
I arrived at the clinic in a wheelchair in a lot of discomfort. That progressed to some pre-op tests that took the balance of the day, and we were asked to make arrangements to be within a half mile of the Institute, ready for Thursday, and that was the end of the day, and that was the first day in months that my wife and I felt some peace that this might have an ending.
The outpatient Bonati Spine procedures are performed incrementally through a small incision. Our patented surgical tools keep surrounding muscles and tissue safe. It's because of these techniques that Bonati's procedures are less likely to cause scar tissue and blood loss and still enable the spine to maintain its mobility. Steve tells us more about his experience in the operating room.
The levels that required surgery was L4-5 and L5-S1. And Dr. Bonati performed a total of 4 procedures to alleviate the pain that I was experiencing at the time. And I watched the procedure on a monitor, and there were only 2 questions that I was asked. Tell me whether your pain is in your back or in your leg. And I was told that that would indicate the position of the nerve and the work that was being done at the time. It was just an incredible experience to have the work done, and I felt a partnership between myself and the 2 surgeons. It was terrific.
The Bonati Spine Institute believes that only a patient should evaluate the merits of their treatment. That's why surgical guests just like Steve from over 33 different countries from around the world trust their backs to Bonati.
After the surgery was complete, I was back in the recovery room, and I was asked by the doctors to stand up and walk down a short hallway and to articulate whether or not I had pain. And I walked down the hall, the pain was completely gone. After the surgery, We left very shortly for home, and I was a little concerned because it was so quick after the procedures had been done. But I felt terrific. We drove home, and once I was at my home, I almost immediately began doing what I was used to do. I could stand and sculpt. I didn't push the envelope too far, but in a matter of a month or two, there was no residual effect whatsoever, except good mobility. So I began to write again and sculpt and walk. My wife and I still walk 3 miles a day, and we enjoy good health. And the whole recovery was really just an ever-escalating wellness that came over me, and it exists today. Since I arrived home, I've been asked a number of times about my experience, and I've had the opportunity to direct people who have serious back issues to Bonati. The reason that I find that easy to do is I feel like I'm doing them a monumental favor.
In the fall of 2018, Steve returned to Hudson to present Dr. Bonati with a gift.
The sculpture that I presented to Dr. Bonati, I actually sculpted 20 years ago. The piece is called Raven's Peak, sculpted out of Canadian bedrock off the west coast of Newfoundland. And it replicates the dark cliffs that ravens used to land on and nest in. And humorous story, when he completed my surgery, and I was so elated, I wanted to reciprocate in some fashion, and he knew that I sculpted in stone, so I showed him my website, and the one that I presented to him was my all-time favorite, and I was pointing all around it, and he said, "Boy, I really love this one." And I said, "Great, it's yours." What do you give a guy who's giving you your life back?
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
This is the honest to God truth, and was recovering. I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody wasn't all like, "Didn't you just get out of surgery?" I'm like, "Yeah, I feel great." And like, "Okay, let's see how you do." And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So a New York surgeon has filed a federal lawsuit challenging the No Surprises Act, a bill that was passed in 2020 which barred doctors and hospitals from billing patients for fair rates if they are out of network, a measure which punishes doctors while pandering to insurance carriers. Joining us is Dr. Daniel Haller, general surgeon in Rockville Center, New York. Thank you for joining us.
Thank you for having me.
So, Dr. Haller, tell us about this lawsuit you filed against the so-called No Surprises Act.
The lawsuit is basically about protecting patients' access to health care.
Okay.
The doctors and physician groups that were involved in creating the No Surprises Act were doing so to protect patients. It was made to protect patients from large bills in which the insurance companies paid X, the doctors charged Y, and there was a difference between the two, which we're going to call the balance bill. Mm-hmm. And that balance bill, by law, the doctors were required to send to the patients. So we were all very happy with the idea of a No Surprises Act. Correct. To take the patients out of the equation, right? You get sick, you come to the emergency room, you don't want to have to worry about who's in your network, who's out of your network. You want the care that you deserve to get. Of course. And you want to know that you're not going to go bankrupt from it. And I and all of my colleagues agree, we never want to bill patients. The law requires us to, but as far as we're concerned, we'd rather waive those balance bill charges. The government put together this statute in order to protect patients from these balance bills. Unfortunately, what it also did was it created an economic price ceiling to what the insurance companies have to pay. Right. Meaning, historically, they would pay the usual and customary rates for that region because we were out of network. We didn't sign on to accept smaller charges. The insurance companies now, according to the regulations from this NSA, they only have to pay what's called the QPA, the qualifying payment amount. And that really is the in-network rate. Right. So instead of paying out-of-network rates, now the government has said, we're going to protect the patients. We're not going to allow you to balance bill them, but we're going to tell the insurance companies that they only have to pay their in-network rates. So this has a lot of ramifications to access to healthcare around America at this point.
Are surprise bills that big of a problem? And obviously your lawsuit is to eliminate this No Surprises Act. To me, that would seem like a good thing, the act itself. Could you further clarify?
The way most docs do and handle balance bills is that they utilize the balance bill to negotiate with the insurance company. It's their leverage to say, well, if you don't pay us more, we're going to go after your patient. Where in reality, 99.9% of the docs that I know, they take the balance bill, they send out 3 invoices because legally they're required to, and then they say, listen, this is too much of a business expense to go after these patients, we write it off.
The insurance company will force the physician to accept whatever they decide to pay. Unless we, once for all, start to negotiate with the insurance clearly what is our situation and what we will accept, not what they will accept, we will be always in the same situation and the patient will be billed.
So let's talk about the ramifications, okay? Yes, we need to protect the patients from these balance bills in which the insurance companies are refusing to pay. I have no qualms with that. New York State actually had the best, until Kathy Hochul destroyed it, they had the best surprise bill law in which the patients were free from any balance billing. A patient hit the emergency room, you were not allowed to bill them a dime. And the insurance companies were mandated to pay something called the usual and customary rate. And how was that created? By a nonprofit organization called Fair Health, which came up with the usual and customary rate that the insurance companies were required to pay. What's happening now is because docs around New York, especially New York, are seeing decreases in revenue, they are now refusing to cover emergency services in the hospitals. You cannot find a plastic surgeon in Long Island that will come in to suture up a child at any point during the day. They're just not doing it anymore. It's not worth it for them. There are anesthesia groups that have pulled out of hospitals in Long Island, which you can't have a hospital without anesthesia. You can't do surgery without anesthesia. No. So the access for patients to get not just quality healthcare, but any healthcare is going to dramatically change over the course of the next few months. And that's because docs are now saying it is no longer worthwhile for us to provide emergency services to hospitals. So this is a big public health concern. In America, we do not have a health care problem. We have a health insurance problem.
Thanks to the AMA.
I totally agree with that. And unless we really put the direction of our fight against the insurance company and we create a system that we have politically or federally protected, Physicians, they need to be able to treat the patients, but also they need to be able to be paid for the services. And
I agree.
And when we have a bill that the patient cannot pay, the insurance company needs to be responsible because the profit of the insurance companies are enormous. There's no reason why they're going to continue manipulating the healthcare in their benefit.
They are not just enormous. United Healthcare boasted in Q1 of 2022 record-breaking profits of over $5 billion.
Yes.
$5 billion. That just so happens it coincides with January 1st, 2022, where the No Surprises Act kicks in, and now all of a sudden they're decreasing the payments. They're paying the doctors for the services provided.
Yeah, and they're pocketing all the funds and ruining doctors' lives by dwindling them from practice. So
United Healthcare has a $500 million lobbying fund.
As we all know, the AMA is in the pockets of the insurers because they created the code that all the insurance companies use. Why aren't they looking out for the best interest of the patient and the doctors?
So the AMA, I believe, was part of fashioning the statute. The AMA actually had their own lawsuit against the federal government. Could be from internal pressures. It's unclear. But the group that I was representing, we weren't going to only allow the AMA to have a lawsuit because we do not always believe they have our best interests in mind. Right. So we felt that we needed to file our own lawsuit to tell our own story.
The insurance company may have all the lobby that they want. We have the knowledge and we have the group. What we don't have is representation. We don't have an American Medical Association who represented us. We've lost that one on the 50s, and from that time on, we lost also medicine. So we need to organize in a certain way that we create another responsible American Medical Association to protect the physician's rights. That's all.
We go into medicine for the patients. We cannot lose sight of the fact that it's really about the patient. Yes, we need to have the ability to take care of them, but what's going to happen over the next few months, I fear, is the access to healthcare for patients, for people, is going to change. And there's going to be a lot of bad outcomes because of that.
Well, let's make sure that doesn't happen. Thank you so much, Dr. Daniel Haller, for being on the program.
Thank you for having me.
Certainly. Thank you for joining us on American Medicine Today. We'll see you next Saturday, 4 p.m. Eastern on Newsmax. And if you'd like to see a previous episode, check out the American Medicine Today page on YouTube. Thanks for watching. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.